Prathip, would you like to present your work?
Yes, Raman. I will discuss with you this morning about the application of the Silver Diamine Fluoride or SDF in the non-invasive caries management. Next, please. As you all know, as a public health people, you know that there are 3 levels of prevention. As Professor Niederman mentioned before, that you see that fluoride toothpaste may be considered as a primary prevention, but fluoride varnish can be as a secondary prevention. But as he mentioned, silver diamine fluoride can be also a secondary prevention. In my point of view, the tertiary prevention is something like ART or IPR in US or the smart preventive restoration, which I will discuss with you today. But many people now, they are trying to use silver diamine fluoride as a tertiary prevention as well. Next, please. As Professor Niederman mentioned also that the ART have been accepted well for a long time, I think more than 30 years up to now. And you can see that the use of the evidence-based review of literature in 2018 mentioned that the ART has been supported by strong evidence, which is ART is a selective remover of the firm dentine. But also we developed from ART to SMART, which is can also support by strong evidence, but that is for deep cavitated lesion by using selective removal of soft dentine in that case. As you know that ART or SMART, for my own consideration, I think this is a tertiary prevention. Next, please. So we think that as Professor Nilan mentioned, the world is changing and the dentistry caries is also changing. The paradigm in caries is changing from the drill and fill restoration to maybe now we are thinking that we can use seal and heal operation, which is more simple and more practical and also painless to be more acceptable for everybody. Next, please. I just would like to mention to you that ART have been using for more than 3 decades since 1987. But now we would like to move from ART to SMART development, which is about 25-30 years after ART. But it's still we're using the same concept of hand instrument only. But SMRT we use a partial caries remover or selective remover to soft dentine. And in SMART we also using capsulated glass enamel, which is I believe it will be better consistency and better power liquid ratio, which will give a better result in restoration as well. In ART at that time, we aim for the permanent molar, but at the primary school student. But now in SMRT, we are aiming at the primary dentition at the preschool student, which we know that now early childhood caries in the preschool student is very high. So I believe that SMART might be more practical in the young children. Next, please. Actually, right now, there are 2 models of SMART preventive restoration. The one that I'm using in the Asia, in that area, we call simplified, modified traumatic restorative treatment and technique, or SMART, which consists of 2 steps: partial caries remover or selective remover to soft dentine, and fill up with a capsulated glass enamel cement. But recently, and the group in the California group, they modify. They're using they call it silver modified ART or silver modified traumatic restorative technique, which they apply silver diamine fluoride to the dentine caries and fill up restoration with the glass enamel cement as well. So there are 2 steps. As Professor Niederman mentioned also, whether these two steps is better or not, we have to prove it's better than just carcinoma or better than just SDF or not. And they take time to prove on that one. Next, please. But what we thinking that SMART in both technique is also practical, especially in the early childhood caries in preschool children. Simplify, modify ART or silver modify ART is now using in many parts of the world in both techniques. But in my opinion, I think that a root caries in elderly patients, silver modify ART might be a better one because, as you know, the response of the pulp in the elderly person is not as good as in the young children. So with the silver diamine fluoride, maybe it might have better effect in this group. Next, please. Why is it the silver ART is have more advantage than just the carcinoma itself? As you all know, that SDF is a 38% silver diamine fluoride, which comprise of 24 to 29% silver and 5 to 6% fluoride in the alkali solution pH 10. Silver ion, it has like other metal antimicrobial. This is the effect that we believe that with the silver diamine fluoride application, no matter just on the dentine, caries dentine, so they will prevent the plaque formation, and then they will also kill the bacteria at the time. But at the same time, carcinoma, as you all know, that is a sealing and bonding with the enamel and dentine, and also carcinoma has a fluoride release. So these two together, they make things more simple, practical, and acceptable technique, especially for young children and also maybe for elderly patients as well. So this is a concept that we think that we call is a no injection, no drill, and no pain procedure. This might be more practical in the community as well as in the children and elderly. Next, please. So I believe that with this non-invasive caries management, silver diamine fluoride has a role both in the secondary prevention and as well as in the tertiary prevention. The secondary prevention, as we just used to silver diamine fluoride to paint on the top of the dentine caries to stop the progression of the caries. But the tertiary prevention, not only to stop the progression of caries, but we have, if you add up of the carcinoma cement on top of the silver diamine fluoride that have been using a part of SMART. In that things, we can think that we can restore the function of the teeth as well. But as I told you that there are two ways of smart preventive restoration, either with silver diamine fluoride or without silver diamine fluoride. So this is the times we show that we say any better on these two things. That is my message to you this morning. Thank you.
Prathip, thank you very much. And Rick Needleman's also shared with us that there's the evidence for SDF as opposed to silver diamine fluoride is still unknown and is developing. But practically, in your experience, what have been the benefits of using a silver ART over just SDF alone?
I believe that if it is the cavitated dentine, if it is not so deep or it's just the beginning of the dentine cavity, SDF alone might be practical because it's something like, as I mentioned before, that this is a secondary prevention, just painting to stop the progression of the caries, which have been proved well in many countries. You know. But in terms of the deep caries or big cavity, I mean, which is only the painting of the SDF alone, it will not the cavity still be there. So in that case, might be top up with carcinoma cement, might be better. So this silver ART might be better in terms of the big cavity or deep cavity in that case, you can restore the function of the teeth and remove the caries and also remove the bacteria from the cavity as well. So it depends on the size of the cavity and on the lesions, I think.
It does. Thank you. I think today's focus is very much on community programs. And I agree with you, in the clinic, sometimes it's easier after you put on silver diamine fluoride to stop debris into a large cavity by placing glass ionomer. I can see on an individual clinic basis the advantage of that. But can you just share with us briefly, before we move on to the next speaker, the difference between using silver diamine fluoride and glass ionomer, the silver ART, as opposed just to smart?
Yes, in our part of the world, in Asia, because as you know, the ECC is very much prevalent especially in European countries also. So we using only simplified, modified ART or smart with only remove caries, partial caries remover and glass ionomer cement only. And we think that may be enough, because we have been working for a few years, 2-3 years already. We have a result for 2-3 years showing that it's quite similar to Professor Niederman data that is reduce the caries by be about 70 to 80%, something like that, with only with smart glass ionomer cement only with our SDF. But since now the silver ART has been using in USA and in some part of the world, we still have not have a comparison about the result of that too. But definitely silver ART might be a bit more expensive, because you have to use both silver diamine fluoride and glass ionomer on the same cavity. But we have to see the cost benefit as well as the caries reduction in this in comparison as well. We need more study to say something about that.
Prathip, thank you very much.